Gracias.
Abro el
Gracias.
webinar en este momento.
We're opening the webinar now. Good luck, everyone.
Tanya, the floor is yours. We're broadcasting.
Muy buenos días a todos y a todas. Bienvenidos a este webinar.
Good morning, everyone. Welcome to this webinar that Evidence Aid and PAHO have organized together to introduce the new joint collection of Evidence Aid and PAHO about health systems and services in disasters and other health emergencies. So thank you very much for joining us today. We are going to be spending about 1 hour talking about and getting to know a little more about this connection. We have many experts with us today that are going to talk to us, with whom we can debate the nature of this collection of systemic reviews. But before we begin, we will give you some technical instructions about the methodology for this webinar. First of all, I'll introduce myself. I'm Tanya James. I'm a specialist in communications on the health emergency department of PAHO. And today, everyone will have access to interpretation. We have interpretation to Spanish, to English, to Portuguese, and to French. And you can access this in the interpretation button that you'll find in the lower part of your Zoom screen. Likewise, as you probably have seen already, we have sign language interpretation available. Our interpreter will be pinned to the Zoom screen so that he's accessible. For questions, we ask you to ask them through the Q&A button, that you will find in the lower part of your Zoom screen. We have lost audio from Tanya. Introductory videos from representatives of PAHO. First of all, I would like to introduce James Fitzgerald, Dr. James Fitzgerald, Director of the Department of Health Systems and Services in PAHO. James, good morning. The floor is yours. Thank you. Thank you very much, Tanya.
It's a real pleasure to be with you here this morning, launching this very important initiative, which is critical, I think, to the future development of health systems that are more robust, more resilient, and have the capacity to be able to respond to the future challenges, not just in terms of pandemics, but of multiple hazard emergencies, and indeed of the growing need to ensure universal access to health and universal health coverage. We, as an organization of member states, have adopted a policy to promote the development of resilient health systems that will allow us to recuperate lost public health gains during this pandemic and to accelerate us towards the achievement of the SDG 30, particularly the achievement of universal health for all. We are in a particular time at present whereby we hope to transition from this public health emergency and to accelerate addressing issues of foregone care, but in a manner that addresses also health equity and facilitates the progress towards the achievement of universal health. At the same time, we have a policy on research for health, a policy that was adopted some years ago that really calls on all member states and the organization as a whole to use evidence to inform decisions for health. We have seen this being challenged during the pandemic. We have seen the proliferation of disinformation, misinformation, and the urgent need for us to gather and garner the necessary evidence to inform decisions that will ultimately strengthen our health systems as we move forward. As such, the collection of evidences that we have prioritized jointly with our colleagues and partners, Evidence Aid, really allows us to identify and summarize best evidence that will support such decisions for health systems, but also to map out existing knowledge gaps that can be ultimately prioritized for research agendas moving forward. So what we've done with our partners, Evidence Aid, is really to present for you an overall series of 124 topics that were prioritized by experts with specific capacities in the management of health services and issues around equity and access. In addition, we will add new summaries as they become available. Central to this process has been the issue of equity, really honing in on those vulnerable populations that have been adversely impacted by the pandemic, so that we can really target the necessary initiatives and decisions that will be required to recuperate their health situation and to support them as we move in the development of health systems to address their needs. PAHO and Evidence Aid have been collaborating for over a decade. And this new collection was really developed in coordination with the Unit of Health Systems and Services, Health Services and Access within the Department of Health Systems and Services, and of course jointly with our colleagues in the public health emergency teams. And I'd like to recognize here the presence of Dr. Ciro Ugarte, who's the director of that department. Evidence Aid is a global leader in evidence and really has been working jointly with us to inform the humanitarian response and to examine the issues around future emergency preparedness and response. The collection we are presenting here for you today will address issues of access, quality of care, financing, governance, knowledge use and delivery of health services, and issues around the health workforce. They are specifically relevant to the context of the region of the Americas, and they cover aspects that are specific to the issues of health equity. We were very aware and we're very conscious of the fact that our health systems need to continue to develop what we refer to as surge capacity, this critical element of resilience where the health system has the capacity to expand rapidly, address existing needs, while at the meantime maintaining essential health services. And these elements of surge capacities need to be coherently linked with issues of supply chain resilience, redistribution of the workforce, and to make sure that in the face of a pandemic or a public health emergency, we can ensure the continuity in the delivery of health services for all. And so we are very happy to present this initiative for you. We know that the collection will grow and expand as we move forward, and this year and alone this year we expect to ensure that support. We are also very happy that this tool will constitute a critical element of our support to member states, and the Bureau will continue to provide the necessary technical guidance in the analysis and the generation of evidence for evidence-informed decisions. So many thanks. With that, I will hand it back to you. Thank you very much.
Muchas gracias, Dr. Fitzgerald, por sus comentarios para introducir.
Thank you very much, Dr. Fitzgerald, in introducing this webinar. And now we go with Dr. Ciro Ugarte, Director of the Health Emergency Department of PAHO. And he will be giving us an introduction to this webinar. Go ahead, Dr. Ugarte. Good morning. Good morning, Tanya, James, colleagues from Evidence Aid, colleagues from PAHO, colleagues from the countries that are participating, and the different institutions that collaborate with the work that we do in our organization. I would like to highlight the importance of scientific development, but at the same time, looking for evidence in just about everything we do. Following James' words, I would like to highlight the fact that the work that we do in the organization, well, particularly in emergencies, is connected to the real, true, practical result. How do the policies and plans translate? How do the ideas translate? How do the strategies translate into something that is tangible, that we can observe and measure in such a way that we can adjust their heading? This has a very big importance in terms of emergencies, because as you all know, during emergencies, well, the bigger the emergency, the more complex the more difficult to predict the actions that will benefit the population that has been affected. This is why in an analysis process, not just analyzing the evidence that already exists, but also working and building evidence on March, especially in prolonged emergencies such as the COVID-19 pandemic. Most of what we do, or the result of this intense collaboration amongst those who produce the information or the data in terms of at the health services level, also in the social environment or the response to emergency, because then the response to emergency is multi-sectorial, using that data to produce information. And that information has to be validated. Find elements such as the use of masks, for example, face masks. I remember that the work that was done with evidence aid experts and Cochrane and the Durham University and many other universities around the world led to one of the very few evidences of the protection provided by face masks in breathable particles. And the origin was protection against volcanic ash. But in the end, this was used to establish the use of different types of face masks to protect the population. So that type of evidence that is meant to save lives or reduce suffering, to control public health emergencies, but also find how the interventions that we do to reduce disaster risk, or including people with disabilities, incorporating indigenous populations, and many other policies that we have, how much of all of that is really having a favorable impact, and how do we then continue with those policies or adjust them in the measure that we get more evidence. That's why this seminar is so important, because it goes to the main point, and that is the well-being of the population. The health of the population, the well-being of the population is the main axis of everything that we do. But for that, we need evidence. So thank you very much. Thank you very much, Dr. Ugarte, for your important message. And before we begin with the panel, that will be the methodology that we will have for this webinar, we're going to have a first space where Professor Mike Clark from Evidence Aid, he's the emeritus researcher from Evidence Aid, is going to give us a presentation about the collection. I would like to remind all of you, those who just joined, that you can access interpretation in each one of the languages that is available, pressing the interpretation button in the lower part of your Zoom screen. Professor Mike Clark.
I'll give the floor to you so you can start your presentation on the Evidence Aid collection.
Thank you very much, Tanya, and thanks also to James and Ciro for those words of introduction, which very nicely set the scene for why we've been working together as Evidence Aid and PAHO to bring evidence into easier ways of people accessing it. I'll say a few words about Evidence Aid, and then I'll tell you a little bit about what we've been doing during phase 1 of this project. It's access to good evidence. How they use that evidence, that's their job. Their job is to use the evidence in ways that will make things better for people in health and social care, that will help us to emerge from the last 2 years, will help us to achieve universal health coverage with effective and efficient healthcare. Our job, I'm an academic researcher. Our job is to generate high quality evidence. And then what we're doing in this project is making that evidence more accessible. So Evidence Aid, we are trying to improve access to reliable information to support well-informed decisions before, during, and after disasters and health emergencies. There could be rapid onset disasters due to natural hazards. They could be the challenges that we face with migration, the challenges that we're going to face even more from climate change and things like the COVID-19 pandemic. We need to be helping policymakers, practitioners, patients, and the public to provide and to receive the best care available so that they can recover as quickly as possible. An evidence aid as an organization was established inside Cochrane, which was then called the Cochrane Collaboration, following the Indian Ocean tsunami. And it's great to see people in this webinar, such as Luis Gabriel Cuervo, who at the time was working at the BMJ and is now at PAHO, who was partnering with us to try and improve access to evidence at that time and built the foundations for the strong relationship that we have with PAHO. We registered as a charity in 2015, becoming standalone from Cochrane. And we formalized our arrangements with PAHO in 2019 by signing a memorandum of understanding. But as James has already said, we've been working together for many years before that. And that memorandum of understanding recognizes the joint recognition of the importance of evidence-based decision-making. So why do we need this? Well, what do we need? We need high quality research that is relevant for disasters and other health emergencies. Then we need the systematic reviews of that research, and the systematic reviews are where the evidence is brought together on a topic, bringing together all of the relevant evidence on that topic to provide the reliable and robust evidence base for the decision makers. They cannot spend their time searching for the individual independent pieces of research. It needs to be brought together. And then it needs to be summarized for them, because the review may be thousands, if not tens of thousands of words long. They need a summary, and it's that last point that we're emphasizing in this work on the Resilient Health Systems collection, making accessible summaries of the evidence. Evidence aid time, and we have special collections, we call them evidence collections, in various topics. We put a large amount of effort over the last 2 years into preparing summaries of COVID-19. There's 585 summaries now available, covering 800 or 900 reviews, because we brought reviews together. But that's from a vast number, maybe 5,000 systematic reviews of COVID-19. Collections on refugees and asylum seekers, malnutrition, natural hazards, Ebola, humanitarian impact of climate change, which is a collection we're trying to strengthen. And then the resilient health systems, which is the one we're talking about today. So in phase one, and phase one took place in the second half of 2021, and we look forward so much to phase two and beyond, working with PAHO to build on this. And my last slide for today will touch on some of those issues. So what did it require? It required the identification of relevant reviews, enhancements to the summaries that we had been producing before, enhancements to the website to make them more accessible, then the preparation of those summaries and their publication. And I'll go through each of these to just give you a sense of the foundations for what we're so pleased to be able to formally launch today. So identification of the relevant reviews. One of the challenges facing decision makers is finding the evidence. And I've already touched on the challenge of individual independent studies that need to be brought together in systematic reviews. But those reviews themselves are then scattered across the literature in hundreds of journals, on hundreds of websites. And so the first step is to try and find the relevant reviews and then work through them, screen them to see which are really relevant. And we divided the work up after prioritization by PAHO of the topics to begin with for phase one. Telehealth, ways of moving healthcare from in-person to online, which became incredibly relevant in the restrictions imposed by COVID-19, but is going to be one of the ways to improve equitable access to healthcare for people who are in remote areas. 900 searches, 900 records were identified in the search, and 200 of those were then screened for relevance. For migrants, 1,200 hits in the literature screening 591 after many had been clear, were judged irrelevant, but still requiring these big numbers to be screened. And you have to put yourself in the position of a decision maker who would not have the time to do this work. Post-event recovery and surge, again, already touched on by James and Ciro, an increasingly important area. Capacities for delivering healthcare in rural and remote settings. Protecting health workers from infection and protecting the mental health of health workers and mental health of victims of disasters and health emergencies. So there is a body of evidence out there, but as I've said, it is scattered. It needed to be brought together. And the green numbers are the numbers that were then screened for relevance. We also had to make the evidence aid summaries themselves better. They already contained the citation to the review, a DOI, a link to the review, and what languages the review was available in, and whether or not the review was free to view. And we've emphasized all along that our resources should be free, and that ideally the underlying review should be free. We added who funded the review. This is one of the enhancements for this collection. We maintained, what is this review about? What is the topic? How was it done? When did they search? How widely did they search? And the main findings. But then we added the implications. So what do the authors of the review say its implications are? And we added the equity issues, which again, James and Ciro have already touched on as extremely important components now of universal health coverage, access to health and social care for everybody. We need to see what those reviews have done about equity. And we added index categories. Again, that was a feature that was already there. So we made the reviews, the summaries of the reviews better, more accessible. Also required enhancements to the website. These are all available online. We grouped them by the categories and we cross-linked to the other evidence collections, so that somebody may see something in the Resilient Health Systems collection that is also relevant to COVID-19, or is also relevant to delivering healthcare after a major windstorm. We added the ability to put a portal, to put a screen, a window on other websites, so that you could then search into the collections without having to come to the collection itself. You could be on a PAHO website, you could be on another website, and you could go in through this portal or through this window to the collection. And a really important enhancement, the ability to download the summaries and the citations for the reviews themselves into reference management software, into software that would allow people to manage the information for themselves. And then preparing the summaries, and this, is also to give acknowledgement to the people that helped as part of this project, to Claire Allen and Jane Cotsby, who are key members of the Evidence Aid team, and organised a large extent of the project, with Yasmin Saeed and Anna Pizarro acting as junior researchers, Faraz Khalid as the senior researcher, checking everything. We piloted working with Louis Gabriel Cuervo and Alex Camacho to make sure that what we were preparing was what you wanted. Each of the summaries was approved by myself as research director, then translated into French, Portuguese, and Spanish, and published on the Evidence Aid website. So a large amount of work and a large amount of checking of the reliability, checking of the relevance, checking of the accessibility of these summaries. As James said, 124 have now been published as phase one, covering many of the priority areas. And I'll just list the priority areas again, and the numbers now are how many summaries are there. 17 summaries of telehealth, and the number adds up to more than 124 because some of them fall into more than one priority topic. Migrants, 20, post-event recovery and surge, 33, building capacities for people in rural and remote areas, 23, infection control to protect health workers, 14, strategies to help protect the mental health of health workers, and strategies to protect the mental health of disaster victims. We're on the beginning of the journey, 124 summaries there. There will be a need for hundreds of summaries. And so what's next? It's a living collection and an evolving process. Material needs to be added. Further enhancements will be needed. More summaries will be added for those phase 1 topics. We will expand to include more priorities for PAHO, including some of those big challenges that we're facing now as a world and that the Americas are facing, climate change and migration. And those further enhancements to include perhaps adding the implications of the review, not of the review authors, but of policymakers. What do they feel these reviews should lead to for current practice and for future research? And the ongoing collaboration with PAHO. So we make the collection as useful as possible to PAHO, the Americas, and also strengthen its global relevance. And it's great to see people such as Kuzia here, who will be speaking in the panel shortly, to see and think about how this could become a global resource. So I'll finish with the URL for the collection. I decided not to show individual examples of the summaries. This is to give you that overview, 124 summaries, all in one place now, dealing with things that will help you, us, everybody improve the resilience of health systems. Thank you very much. I'll pass back to Tanya.
Thank you very much, Professor Clark. Muchísimas gracias, Mike Clark.
Thank you very much, Mike Clark. And here in the chat, you have the link that Mike had in the slide. This is the link where you can access the collection that he showed us with a lot of details and functionality and possibilities in terms of methodology, techniques, and also a strategic when we're looking for evidence that will allow us to improve preparedness, response, and the different capabilities of the different health services to respond to different emergencies. And with this, I would like to go with our panel. Mike had told us, well, I also said that we were going to have a panel today, and we have 2 experts that whom with we will debate the global perspectives and the country perspectives. That is important because this is where you would appreciate the functionality of the new collection. So I'd like to introduce, and I asked them to turn on their cameras. I'll introduce Paola Pontoni, Director of Minister of Disasters in the Ministry of Health of Chile, and Dr. Kuzia. I'm sorry, doctor, if I am not.
You can pronounce your name because I'm so embarrassed to say it badly. Please go ahead, Dr. Kuzia.
Thank you very much. I'm very pleased to be here today. You said my name very nicely, actually, better than me.
Great, thank you.
So good afternoon from Geneva. Very honored to be invited at this important event to listen to you all. Delighted to be part of this panel as well and sharing the panel with this expert and then the director from Chile Ministry of Health, Dr. Paola. And also thanks for giving me the opportunity to share my thoughts around this topic. Thanks to PAHO for creating this opportunity and inviting me. I will come up with a bit long story, and then please bear with me because I need to make my case. I need to, that's where we need the evidence. That's where we need the information. We all know that millions of lives and livelihoods are impacted by health emergencies and disasters every year. This impact of emergencies and disasters, however, is often most heavily felt amongst the vulnerable populations. COVID-19 has been no exception. Preliminary estimates suggest that the total number of global deaths attributed to the COVID-19 pandemic only in 2020 is at least 3 million, representing 1.2 million more deaths than officially reported. As our Director General, Dr. Tedros has stated, the pandemic has magnified the divisions in societies with the impacts borne disproportionately by the most vulnerable. It comes at a time when we can no longer fail to acknowledge the direct link between the health of populations, environment, and economic and social systems, we can't do all these things. We can't actually establish the linkages and take the right actions without any information, any evidence. While the world's attention has been focused on COVID-19 response efforts, countries have been continuously facing other emergencies like hurricanes, outbreaks, flooding, earthquakes, and not to mention the prevailing humanitarian crisis, resulting in stretched health system, including health workforce, challenging the essential healthcare services for maternal and child health and other communicable and non-communicable diseases, etc. So I would like to share some numbers with you all. From this recent survey that was conducted, it shows that 91% of countries reported at least some level of disruption of essential health services in Q4 of 2021. This Pulse survey also reported that 40% of countries report increased backlogs in multiple health services in the second half of 2021, including cancer care, NCD care, and rehabilitative care. Nearly half of countries reported disruptions to both routine facility-based and outreach immunization services. The reason I'm actually sharing this information with you that it's not only the numbers in terms of impact, but also which part of the year it happened. It has got some implications because these numbers are changing the games every day, helping in making decisions, interventions, and impacting actions, including research priorities. These are important, very important to make our case. The pandemic has exposed the fragilities and gaps of health and all other systems everywhere across the world, which grossly impacted countries' socioeconomic sectors, pushing the already vulnerable populations towards the extreme poverty line. Vulnerable populations already living in poverty are often disproportionately hit by any crisis, emergencies, and disasters. Among all highly vulnerable populations, risk from different hazards, including epidemics and pandemics, and climate-related emergencies are closely interconnected, and multiple concurrent emergencies can exacerbate each other's impact, depleting communities' resilience and pushing them beyond their coping capacities. Actually, what is happening? That's what we need to know, always. The pandemic has affected populations in situations of fragility, conflict, violence, and other vulnerabilities particularly hard, especially displaced populations. Therefore, now more than ever, it is critical to maximize the available resources, be it finance, human, and others, to manage risk from multiple hazards. Countries must know and be prepared for the right threats, as the countries and communities are not facing only one at a time, unfortunately, but many. That's why it is important for the countries to develop capacity system mechanism efficient enough to manage multiple risks using a right-based approach to be inclusive for equity. These are all very big words that I have mentioned, and then these big words are actually very important and in taking our actions based on what? So we are working with the countries to adopt the all-hazard health emergency and disaster risk management measures, which should be integrated into any emergency actions, following a right-based multi-sectoral approach based on systematic risk and vulnerability assessments to guide preparedness and response planning and allow countries and communities to act in a more anticipatory manner and facilitating most effective use of limited resource, as I just mentioned. Health emergency and disaster risk management allows countries to consolidate available evidence, map in-country risk, and apply the risk evidence to better inform planning, capacity development, and other key actions across the emergency management continuum that my previous colleagues speakers, they have already mentioned, from mitigation, preparedness, response to recovery, for strengthening health system, which is a precursor of whole of society resilience, from governance, systems, and to communities. This also includes the continued efforts on safeguarding health facilities at all levels and improve their resilience with a focus to primary care. We have heard from our colleague, Dr. James Fitzgerald, that resilient health system is key to universal health coverage. And also I would like to pull in the discussion on the health security. It is equally important for health security as well. Adoption of all hazards, health emergency and disaster risk management measures to capacitate health system accelerate that process of resilience, ensuring equity and sustainability. This is also key to achieve sustainable development goals in countries. So just one more information, that Pulse survey that I was referring, results says that nearly half of countries have plans in place for building longer-term health service recovery plan to strengthen resilience and preparedness, with an additional 40% of countries don't yet have recovery plan in place. I see that this is an opportunity, and this is a perfect timing to discuss this issue and how we can use this whole evidences that are being generated into that recovery process to build better for future. So why I have been sharing all those information today? It's only because to reflect on how important the information is to use as evidence for a better efforts for emergency and disaster risk management. Collecting information, analyzing it, presenting and reviewing information with periodic review, as we have heard from Mike, is key. It needs to be a continuous process and sustainable. It also needs to be based on standards and also the effort we all should make to make all this information in one point, so that the standard information are used to harmonize all the actions across the board, again, directly linking it to the resources, which are very skimpy all around. I would also like to refer to authentication of those evidences as well. You all know that during this pandemic, misinformation has become a big challenge, and the infodemic program was launched by WHO to address this challenge. This is not only responsibility of health sector as well. Making health system resilient should be a task of all in societies, all in governments. That's why making the evidence needs to be for the health betterment of health system is the responsibility of all. We have learned this in a very hard way during this COVID-19 pandemic. Collaboration of stakeholders, sectors is hence the key. To enhance such collaboration among all relevant sectors in emergency and preparedness, WHO leads many efforts on integration of health emergencies and disease outbreak in national disaster risk management strategies by bringing together relevant stakeholders from different sectors in the development of national emergency response operations plan as well. This is a very important contribution, I would say, to a risk-informed and inclusive COVID-19 recovery that builds resilience for future emergencies, including pandemics. That's why I would also like to highlight that further need in this area, further need for developing evidence in this area is critical. Information and evidences around risk, vulnerabilities, and also how to make our investment cases. Such policy level actions require evidence to make investment cases, as just mentioned, which helps in drawing resources towards health system improvement for resilience. We need to carefully note all the lessons, all the experiences of this current pandemic, the interconnecting risks, interconnecting impacts, interconnecting sectors, governance, communities, whole of societies, the global leaders, as all of us, as the health workers, on how all those reacted, what we will have done and what we all could have done to reduce the sufferings, reduce the unavoidable deaths, to reduce the socio-economic loss during this pandemic. These are very important. Such evidences are crucial. Such evidences are critical to build a better world for future, where the communities are prepared for any unseen, unpredictable threats. Whole of society is engaged with all possible ways and means. Governance is agile to take up the challenges, and equity is preserved. We need to do everything in our capacity to build those evidences and to use them in building the post-pandemic world, which is prepared enough to save more lives, lessen sufferings to make up to the lost childhood of the children during this pandemic. We'd rather not forget that each of us will only have one chance in the lifetime to make the world a better place. Let's do it together and for a better reason. Thank you, and back to you.
Thank you very much, Dr. Huda. Muchísimas gracias, doctora, por darnos esa visión.
Thank you very much, Doctor, for your vision from the World Health Organization and the work that you're doing in the emergency health programs in the countries to improve the decisions that are made at a country level based on evidence and issues related to risk management. And with this, I would like to go with Chile, where we have our other expert joining us from. She is the Director of Health Disasters and Emergencies from the Ministry of Health of Chile, Paula Pontolis. Thank you very much for joining us today. And I would like to continue the conversation about how this collection and how this evidence can impact the work done in the countries. You who are in the first line of the work done in the country, how do you believe this country can improve the work that the country does? Thank you, Tanya, and good morning, good afternoon, or good evening, everyone. I know everyone is in a different schedule. The truth is that to give some context about how we see it in Chile, as you know, Chile, well, many people say that we're a disaster lab. Unfortunately, we have many natural disasters and then anthropic disasters, and as Mike and James have said, and the rest of the speakers have said, climate change is an issue, and a lot of times we used to look at it as a different disaster, but it does affect the health of people and health systems in general. If we look at all of this, and like Dr. Huda said, there is an issue here related to emerging diseases, or this pandemic that right now is, well, has us all working to be able to save as many lives as possible and then go back to normality as soon as possible, or possible normality that we can achieve. But we add other emerging and re-emerging diseases that are associated to multiple causes, such as climate changes. It could be droughts, for example, or heat waves, the reappearance of other diseases that are maybe repopulating some regions. And this is not something that we just see in Chile or in the Americas. We see it in other countries and other regions too. This is something that concerns us. That is why, in terms of this collection that Mike is introducing, where you have the great advantage of concentrating the knowledge with the best available evidence in one single place, where for those of us who work in that daily, for those of us who work in risk management, and where the decision makers can get to that information that is already categorized, summarized. This can help us to generate new public policies. It can help us strengthen the policies that we already have, or reformulate them. And it is very important, even though what brings us here is health systems or strengthening health systems. I say that Mike's collection, I think every issue that is addressed can go towards a resilient health system. If we look at migrations, climate change, if we look at, you have there Zika and chikungunya and other diseases, we should be able to work in multi-threat plans where we have to have new maps of our capabilities in the health sectors, and having evidence about the threats in the region and whether there is a gap. How do we create incentives to work on what hasn't been studied yet, so that we can incorporate the necessary public policies? As we all know, public policies are meant to save the greatest number of lives. This applies to global policies. This applies to not just national policies, but we also can work as a region. We know that we have a globalized world today, so this is something that we face in the pandemic. For example, for Chile, it came from Chile is a remote and far away place, but it didn't take long to get here. And all the implications that this has for a system, a pandemic that Dr. Huda said, is not just the consequences to health and health systems. It also affects the economic system, the social system. It impoverishes a part of the population or even a country. How does this generate problems to mental health for the population in general, also for the workers. So I think that, and I insist that the wealth, the richness of this site, of this sort of database that gives us information that has been reviewed, that tells us the level of evidence that we can subscribe to so that we can work on our public policies. And if we can continue with the WHO and PAHO and generating other research instances that can support our countries to generate not just a system, but I'd say countries that are resilient to disasters, when we change the paradigm of working in the post-disaster, because I'd say most of the disaster policies or the improvements have been post-disaster, unfortunately. We have to change from correction to prospection. And I think this is a great addition. And this is something that we're getting from academia and the research institutes. And we have to learn to invest in them so that we can mitigate and prepare for future emergencies. And I would say not just biological ones like the pandemic, but also social, technological, and others that can affect our health systems. Thank you very much, Paola, for your perspective from your daily work and your current position in a country. I'd like to remind everyone that you can ask questions through the Q&A, and Paola, I'll go with you now, and I'd like to ask you, what issues or areas do you think should be included in this collection? Because we know this collection is a living collection. It's going to continue expanding. That's what Mike told us and some other panelists told us in this introductory session. But from your country perspective, from your area of work, what topics would be important to be included? And what other collections from Evidence Aid inform the technical work that you do in the country? Okay, so the truth is that the resources that this database has, the Evidence Aid has, we have the natural disaster events. There's also a lot about earthquakes, cyclones, hurricanes. We also have how it would affect what Mike was saying, the post-traumatic stress syndrome, for example, how we manage that. And this is for the general population, I would say, but also for health workers. I would say that this pandemic has been key in seeing how a disaster like the pandemic or a catastrophe like the pandemic that is not sudden, it's something that is chronic now, is affecting and wearing down health teams and how we generate policies. I think the evidence that has been generated and how we advance on this is very important. I think Mike's team has a great challenge because even though we have some, I mean, within the disaster, we're still working on how the pandemic is affecting us. But I think it would be very good when we consider the cycle closed and we can retrospectively look with data, look at which were the main things that affected both physical and mental health of the teams, the health professionals, how this impacted health systems, maybe in the level of absentees, the reason for absenteeing, how different health systems recover. I mean, I think there's something connected to how to generate health systems where the disruption of the service, maybe study what type of services were the ones that were disrupted. We've also seen this when we had to monitor the pandemic for Sendai, the Sendai framework, where they ask you to give value to the losses or assign values to the losses. And if we assign values to the pandemic, and we do have services that we haven't been able to provide. We have personnel that has been affected. We have loss of life. We have consequences of the pandemic for the teams and for the persons. So if we can have evidence on that, this could be useful, as PAHO and WHO have done, to strengthen the international health regulation in certain areas, to allow us to reinforce what the regulation says and to see how the different countries can support each other, because I insist that there's a globalized nature to disasters. I mean, before, the connection was a lot slower. Now we do have fast transmission. We can be affected by these types of events. Therefore, I think that we have to work in reinforcing certain lines of work on the threats and risks, but we also have the impact of climate change, the impact to the population. For example, how many studies are there for disease load connected to climate change? I think this is something that we have to do, because we'll be able to create more resilient health systems, because we'll know where to invest or what type of specialized teams we may need, depending on the effects that they have in each one of the regions. Because there's different effects in different regions. Maybe there's bigger landslides and floods in some areas, floods like we saw in Brazil that took many lives. So we have to see how the health systems respond and where we can install our new facilities, and how do we mitigate when there's no other solution or no other place to install the facility. So I insist, Mike, and we will be hoping to see the evolution of this collection, because I saw it and I was positively impacted. I liked how it was classified, indexed, and the level of evidence, and now I know where to look. If you say that there is studies that have a low level of evidence, well, of course, if there's nothing more, I'll have to check them, and maybe as a country we'll see where to look. But I think it's a very good tool for decision makers and for the teams that work here in how to support decision makers in creating prospective policies to create mitigation measures for resilient health systems. Thank you very much, Paola. We have received a question for Dr. Huda. I'd like to go back to her. I'm going to read it in English.
What challenges, Dr. Huda, do countries face to have better evidence-informed decisions on emergency and disaster risk management?
Thank you very much for this question. I think that this is the question. It's a question of the day, I would say, because this is where the problem is, and this is where the solution is as well. First of all, at the country level, the main challenge is that risk information is not available in many cases. Risks were never been prioritized. And then again, accessibility to risk information is not there. So this is one of the key challenge, I would say, that in countries to make evidence-informed decisions for emergency and disaster risk management. I think that this is why it's very important that we create that risk profile for countries. We create that risk information for the countries and evidences around this risk vulnerabilities and capacities. The second point here is that the risk information is completely disconnected from the decision-making process, completely disconnected from the resource allocation, because risk information has been all this time, like, even though some countries, they do develop their country risk profile, they do collect their risk information, but somehow it remains in an academic envelope, I would say. It's not seldom it's been used for application in taking action. So this needs to be bridged. So that's another challenge I would like to mention. Another very important factors from my experience, you know that in WHO we developed these methodologies, we call it STAR, Strategic Toolkit for Assessing Risk. So we have by now applied in 74 countries this methodology to develop the risk profiles. And then you can imagine these 74 countries, they have their own risk profile, they prioritize risk, they prioritize their actions around that as well. And then the whole methodology is as such that it brings in all the stakeholders together. Then where is the problem? So when we started going back to the countries and see that how many countries have actually used this information, this is where we got started, because this information are not really presented. This information, I think that Professor Mike mentioned during his presentation, the importance of wrapping, packaging this risk, how you can make it visible, any information. So this is a problem. And also another problem we have noticed in the countries, that countries are very shy or very sensitive to share their risk information with others. And then this, I would say, it's a misconception, because if you share your risk, there's more opportunity for taking risk-informed action. If you don't share your risk information with all your stakeholders, there is a more probability of taking actions which are not actually priority, which are not connected to the actual need on the ground. So I think that this is very important to also look into this. The reason the risk-based action in a country, it varies from countries to countries. Say, for example, in small island developing countries, their needs for this, for risk-informed actions would be very different than need for risk-informed action in other countries. Maybe in the protracted emergency countries or countries where the emergencies are not quite often. So that's a reason we cannot say that one size fits for all, that there is a rule of thumb. Only rule of thumb is assessing your risk, identifying your risk, packaging your risk. Okay, so I think that three things I would like to highlight here. I would also refer to Dr. Paula, who mentioned international health regulations and Sendai framework. These are the two very big and important global instruments which countries are responsible to report to and which countries actually agreed to implement. And both these two global instruments actually highlights the need for assessing the risk at the country level, because this is the main challenge, that not having the evidences and information around risk. I think that prioritization of risk and taking the risk from presentation of the risk to take the risk-informed action from prevention, preparedness, response to recovery would be key. Second thing, I think that would be very important to create that risk-informed governance. This risk-informed governance, and actually as a part of whole of society, would further facilitate to take forward and advance this health emergency and disaster risk management in the countries, and also contribute in getting the evidences. Last but not the least, I think that it is very, very important to not only to identify the risk, creating the evidence, but also using these evidences in mobilizing the resources and allocation of the resources. Because our resource allocation and our decision of resource mobilization is often very disconnected from the risk. So I think that what we are discussing today, we need to create more evidences, we need to create more information, ensuring not only the generation of information and also ensuring the accessibility of this information to take those actions, to take risk more closer to the decision making, to more closer to the governance, and more closer to the resource allocation and resource mobilization. That's how we can actually advance the emergency and disaster risk management more, and we can say that these are the evidences we can use in there, and we will be able to overcome the challenges. Again, just going back to what I just said in my last intervention, this is not the job of only health sector. This is not the job of only one sector. We all need to work together. We need to find out ways and means how we can create that platform to put all our efforts together. I think that what evidence aide that just shared with us that some of the areas they have created the evidence, they have generated the evidence, and then I think more needs to be done, and where we have our commitment to work together jointly with them. Thank you, and back to you.
Disculpas. Thank you, Dr. Huda. Thank you very much for that recount on a very integral view on how the countries need to use the evidence, not only in the disaster phase, but also in the preparedness and in the planning of a disaster phase. Thank you very much. Muchísimas gracias a la doctora Huda.
I'd like to thank Dr. Huda and Paola for their participation in this panel. I would like to know whether anyone in the audience has any questions or concerns, comments that they would like to make through the Q&A. You can also use the chat. We have a contribution from Claire Allen. She is part of the Evidence Aid team, and she reminds us that if there's anyone who is interested in receiving regular updates from Evidence Aid, they can send an email to info@evidenceaid.org to receive the newsletter that they send with examples of some of the systemic summaries that they have in their website. Thank you very much, everyone. I'd like to finish. We are now at the time, and I'd like to remind you that on the 15th of March, we will be introducing the second version of the course on assessment of health facilities in the Hospital Security Index. This is framed in the Safe Hospitals initiative that we had in the Health Emergency Department in PAHO, and you can follow our social media, and there you will find more information about the presentation of this course that will be available both in Spanish and English, and it will be carried out on the 15th of March. And I'd like to finish by thanking you all. Alex, I don't know if you want to say anything. Thank you very much, Tanya. Thank you very much, everyone. I'd like to thank all our guests and panelists, and of course, Evidence Aid. And to finish, we will go with Gabriel Cuervo, who is going to do the closing of this section. Thank you very much, everyone. Go ahead, Luis Gabriel. Thank you very much, Alex. And I'd like to recognize the extraordinary work that has been done. We've heard from the excellence that the work that has been done and the competences that were included. And I'd like to go back to a couple of points. One is the operational part, where we have the people with the best competences going to the teams. And in Evidence Aid and in PAHO, we've had big teams behind all of this work, not just the people that we have heard from today. I'd also like to very briefly talk about the strategy and the vision. I loved how Dr. Pontoni said this. An essential element of everything that has been done is to start with the needs of those who are using or need to use this information, and why. A fundamental element is to build trust. This is something that we have seen that in the response, and it's essential to resilience. We have to have trust from the community and trust in decision makers and from decision makers. That is why we have to look at and search for those needs and provide for those needs. And it's very important to mention that in this process, there has been that interaction between those who have to make decisions in terms of resilient health systems or disaster response, continuity of services, to see what they need to do what they have to do using evidence. This collection is not happening in a void. It's there to fulfill a need, and it is looking towards the future, moving ahead, as Paola was saying, being ahead of the event so that we can be prepared for them. So that is the final point that I wanted to make. Being grateful for the participation, and we're very happy to have the number of people that have been participating in this event and the great teams that we have, so that we can continue and be useful for the Americas and beyond. Thank you very much. Thank you very much, Dr. Cuervo, for your final contribution. We'd like to thank everyone who has participated today. Alex, is there any final remark? No, just I'd like to repeat our gratitude, express our gratitude to everyone and the countries, of course, that are the users, the main stakeholders, the ones who we make the process with and for. And we hope to see you on the 15th of March. We'll have the self-instruction course through the Hospital Safety Index, and you will be the main stakeholders in that process too. We will briefly provide the link in the chat, and we hope that you join us. Thank you, Tanya, for moderating. Thank you very much, Luis Gabriel. It's an honor to work with you. Kutsia, Paola, Mike, of course, his support and evidence aid support. And I'm sure we'll continue working. Thank you very much, Zero, James. Good afternoon, everyone. Thank you very much, everyone.
Bye-bye.